So it was like a commitment was made and then the commitment was withdrawn, and the reason for it had nothing to do with the qualifications of the individual, how good they were, none of that.
It was this other.
It was entirely politics. It was all politics. And so, but I think my point in telling you that story is that that was the first time that in very unvarnished fashion, we had a glimpse of what the whole thing was really about. Yeah, all right.
Dr. Yaghmai, thank you for being here today. Do you prefer to be called Dr. Yaghmai, Elisha Yaghmai?
I go by Elisha, yeah.
Elisha, okay.
Yeah.
I'm Jo Hanlon. I'm with your marketing company, and this is our first podcast that we're doing together of this nature.
Yep.
And so tell me about why we're here today, what we're doing.
The point of the podcast is to start to talk about healthcare issues that are of concern to not just our patient population, but really the entire country.
Yeah.
So there's a lot that has happened in healthcare in the last 10 years, and that was built on the legacy of things that did and mostly did not happen over the previous several decades. But I think most people in the country are aware of the fact that the prices of healthcare keep spiraling up. And then at the same time, what is being delivered to individual patients is often spiraling down.
Right.
We've also just come out of a massive pandemic that was very destructive to the system in ways that aren't always obvious to people that are outside of the system. So there's just layers and layers of issues at this point that need to be discussed that in many cases are not being discussed, even within the sort of public sphere or the kind of general media. When we're talking about healthcare, the issues that are deemed to be important are often not the ones that are really the most important when you're looking at how do we fundamentally improve this whole system of delivery.
There were probably already stressors and already cracks in the system, and this just super exacerbated it. Does that feel right?
Yeah, 100%.
Yeah.
I mean, the classic example would be, we'll just use, here you can pick almost anywhere in the system and find issues to discuss. But one of the things that COVID did was result in huge staff losses across the entire country.
Yeah.
I would say that probably the medium-sized and smaller communities have felt this the worst because they already had a smaller population base to begin with, right? Yeah. So when a bunch of your nurses quit there, it's not like there's 1,000 more that are walking through the door because you're in a 20 million person city, right?
Yeah.
You're a city of a few 100,000 people. But when the pandemic broke out, for one, there was a general lack of preparation. But for two, you had these widely disparate responses based on how wealthy the hospital system was, how wealthy the community was, what kind of protective equipment they could even supply. There were hospitals that had barely any or were having the nurses buy their own, right, to come in and work with a life-threatening illness. Right?
Gosh.
Nurses were being asked to work 12-hour shifts, right? So and then of course some of the nurses are getting sick, right?
Yeah.
And all these things are happening. Patients are dying at a much, much higher rate than we're usually used to seeing within almost any type of condition, right?
Yeah.
All of that stress is coming together on the legacy of we already had all of these problems and grievances that had been boiling for years under the surface. So a lot of nurses just left, right? And then what you're left with is a hospital that has beds but no staff. And then you have patients who
need the beds,
but can't even get in.
Can't go to them because there's no one to staff them.
There's no one to staff the bed, yeah.
So let's back up to before the pandemic. What I know you from is Free State Healthcare Clinic here in Wichita. And so I know you only a bit so far, but I have heard your heart in terms of this being part of your driving, motivation in this clinic is that there are this underlying factor that there are flaws in our healthcare system, the big system, and that you're trying to find creative solutions to alleviate some of those pain points and to help the population actually have access that is affordable, is helpful, and is not an overarching strong arm of you need this healthcare piece and stuff. So let's talk about your journey. How did you start to get into medicine, and have you always felt this way, or was this something that kind of happened as you went through your medical journey and you started to see some of those flaws?
After college, I went to live overseas and do some teaching.
Oh, okay. Where was that?
So I was in the Ivory Coast in West Africa.
Okay.
So
Nice.
I went there, and it was a really, really fascinating experience. Very enjoyable. I learned an enormous amount. And I had an interest, even in college, in international development and healthcare and these kinds of things. So I went and started working there, and then one of the things that occurred to me was, okay, I really think I'd like to come back and work in places like this, in countries like this, in this kind of an environment. But the point was that, there were people there that clearly was, there was poverty, there were other types of issues. And so I had a strong interest in international health. And I thought, okay, if I'm going to come into this environment and work, I think I need some kind of practical hands-on skill, right? Okay. I don't just want to show up and say, hey, you know what, I can push paper around and write paragraphs.
Right.
I need something that I could actually do to help people in a very practical way. And so I thought, okay, well, you know what? I'd already been thinking about medicine. That was kind of the way that I was tracking the whole time.
Yeah.
Maybe medicine is the right answer here, right?
Okay.
Because then when I go to a village, right, if someone is sick, I can actually help them.
Yeah.
So that reinforced
the desire.
So then
you came back and you started med school.
Right.
Where did you go to med school?
I started off at Tulane. So it's in New Orleans.
Oh, okay.
Yeah. Mm-hmm.
Nice.
So Tulane had a tropical medicine program. So I was completely, at that point, I was completely trying, I'm gonna get my medical degree and then I'm gone. I'm going to somewhere overseas.
Tropical medicine?
Tropical medicine, yeah. So it's regular, so there's medicine, which is your typical MD program, which what I was doing. But then they also had a tropical medicine program that you could do as a supplemental degree, or supplemental certificate program on top of that.
Okay.
Where they train you basically in tropical diseases, meaning diseases that are most common around the equator.
So then where did you go from after, like you graduated, where'd you do your
residency?
No,
I didn't.
So, you didn't?
No, so the very first disruption was midway through my medical education, 2 years into it, Hurricane Katrina hit New Orleans.
Okay.
Yeah,
that was right then.
So at least in my cohort, most of us weren't there.
Okay.
Because the hurricane hit on the weekend. So we at that time had just started what we call clinical clerkships, which is it's changing a little bit over time, but it starts in your third year.
Yeah.
We had just finished a clerkship. It was on the weekend before we switched to a new one.
Okay.
So many of us had left town.
Wow.
Just
happened. Just
fortuitously, yeah. And and we didn't. In New Orleans at that time, hurricanes were a thing that happened, but
not like that.
Yeah, well, I mean, they occasionally had some bad ones, but most of the time, the hurricane was a thing would sort of blow over.
Right,
nothing really major would happen.
Yeah.
So I think it's safe to say that, at least from the perspective of those of us that hadn't lived there for a long, long time, we weren't too worried about it.
Right.
And to the point that even when the hurricane was hitting, I was in Texas at that point. I was trying to get back. I was, because they canceled the flights. I was like, okay, let me try to rent a car because I need to get back on Monday.
Yeah, right.
And be there.
No idea what's happening.
No idea, right? And then woke up to find, the whole city had flooded and all the tragedy that went on after that.
Yeah. Wow.
Essentially for a while, the school was completely shut down.
Yeah.
And what we learned at that point was that if there was a contingency plan, it was not followed.
Right.
But there appeared to have never been a contingency plan. And what was interesting about that was that when you moved to New Orleans, one of the very first things you learned, at least in the years that I moved there, was that if there ever is a really, really bad hurricane, this city is going to flood.
Like everybody just accepted
Everyone kind of knew that would happen, right? Mm-hmm. But what didn't seem to have happened was anyone actually planned for what if that actually happens. So for example, the report that we received, I never verified this independently, was that all of our email servers were in the basement of the medical school, right? Which flooded. So all of a sudden we had no email, we had no way to communicate with anybody, right? Wow. So the medical students set up basically a side chat.
2006?
This was 2005.
Right? 2005. Okay, yeah.
So there was no mechanism. So the med students set up this sidebar thing, and then that began a multi-week sort of saga where the medical school was just trying to sort of pick up just reorganize, kind of get things put back together. Obviously, people had lost home. I mean, there's just all this chaos and destructions happening. But from the medical student perspective, we were just sort of dangling out there with no real guidance. And so our experience was that the institution took care of the preclinical people faster. They took care of the undergraduates at the university faster. But the medical students, and I think to some degree the law students, if memory serves, were kind of left a little bit later, probably because it was harder to arrange. But we were just, and when I mean dangling, I mean we didn't have our financial aid at that point because we hadn't gotten the money had not been processed, right? So we were because
everything's just shut down.
Oh, 100%, yeah. So we were out of money. We often didn't have anywhere to live, depending on what the situation was.
I was going to say, did your home get?
Yeah. Well, my apartment was high. I was in an apartment building. I was high enough that it didn't get damaged directly, but I couldn't get to it. But not livable. I couldn't get. I'd have to sail to it, right?
Yeah, right.
I mean, that was the actual reality. So all my things were there.
Yeah.
And so that was, so it just began this really high stress period.
What a way to start your dream. I mean, that's really interesting that was part of your piece. So
it wasn't just that. It was that it actually, over time, it became relatively adversarial. So the students felt abandoned And I think in retrospect, thinking back now, being older, I think to some degree we lacked a little bit of empathy in terms of thinking about, hey, these medical school deans, right? These are people.
All the pieces that they're trying to get back in line.
They have families and lives and things they're trying to do, right? But at that time, it just felt like, basically, we've been kind of hung out here. Y'all aren't helping us. You're not doing anything for us. You don't even have a plan for any of this.
Just stuck in limbo.
It's just absolute chaos. So that, over time, the interaction, I think, just became increasingly angry and adversarial between the faculty and the students and the school and everything else like that. So in that context, several of us left. So that's actually what happened. We applied for transfer and ended up transferring out.
Was that was there anything in place that helped that be more seamless than normal?
No, it was
because of the circumstance.
It was pretty difficult. I mean, essentially, you had to find any. So one of the things that happened was that several students wanted to transfer out to continue their education. There were some backroom politics that went on to try to prevent that to a certain degree. So what happened was a few people had the idea, kind of came out, moved on it quickly. As that began to percolate through the population of students, more people began to realize that was possible. More people began to try.
Do that,
and that is when that's when the gloves came off to a large degree in terms of
the aggressiveness.
The aggressiveness, because the school is looking at this and saying we're about to lose all our students, and again, I won't comment on what their motivation was, but they could see that they were
stress in both directions.
They were about to lose the students,
Yeah,
and so then they began to get much more aggressive about retaining the students. So people, for example, might be accepted to transfer somewhere, and then all of a sudden receive word that your transfer has been rescinded.
Yeah.
Because they called us
because the school you're coming from was rescinding.
No, because the school you're going to, the school you're coming from had no right to interfere with your transfer. But
where you were going.
But the backroom politics were, if this person calls that person, these two people are colleagues, they're going to have to work with each other in the future.
Right.
So if you, from their perspective, right, if you kind of stick a knife in them now, right, then later there's not going to be a good relationship.
Yeah.
So what ended up happening was, for example, there was one student that had been accepted to transfer somewhere a little bit further east in the southeast. He was ready to start. He got a call the day before he was supposed to start his new place saying, sorry, your place has been rescinded. You're going to need to move to Houston.
The day before?
The day before,
wow.
100%. And he was the only person that ended up in that type of situation. So it was like a commitment was made and then the commitment was withdrawn. And the reason for it had nothing to do with the qualifications of the individual, how good they were, none of that.
It was this other
It was entirely politics. It was all politics. And so, but I think my point in telling you that story is that was the first time that in very unvarnished fashion, we had a glimpse of what the whole thing was really about, right? Because if you think about it, I always thought about it two ways. On the one hand, everybody involved in this was a human, right? This was a huge, massive natural disaster. It was a tragedy. Yeah. All kinds of terrible things happened. Yeah. The fact that there was chaos and uncertainty, in retrospect, is not surprising. I think that there was a lack of empathy, I think, on the part of us as the students for the fact that the people that were sort of putatively in charge,
both directions,
but I think it extended in both ways.
Yeah.
And I would say when it really got tough, right? When it came down to things like we're about to lose a bunch of tuition-paying people, then the teeth really came out.
Right.
That was kind of what we experienced, right? Then the teeth really came out, and we saw things being done. I mean we still have, I think, the emails and various other things that went on.
Right.
Then things were done that really, number one, were not right, and number two, were not in the best interest of the student, if that makes sense, as a student.
Right.
So it was, we're going to forcibly retain you here, even though we don't really have a good structure to receive you.
Right. Like we can't do anything with you right now. You're still stuck in limbo,
That's
but we
correct.
can't.
Yes. Or we're going to move you to, I mean, so what ended up happening was they did a timeshare thing with Baylor College of Medicine, right? But what was happening was the Tulane people were add-ons, right? They were a third wheel everywhere they went because Baylor had a structure set up for their own student population, not all these new people. Yeah. So you're bringing these new people in to be excess weight in a place where they, number one, they're not exactly ready for them. Number two, they're not exactly welcome.
Yeah.
Right.
So is Baylor's where you ended up going? Is that
no, that's not where I went. That's not where I went. Yeah, but this is where many others went elsewhere. Some, like I said, did transfer out to other places, but a lot of them went there. And then when they brought them back for their fourth year clerkships, right? New Orleans was still decimated. So there were, the hospitals were dysfunctional. There was a lack of logistics and resources. They didn't always have the patient numbers. They didn't have the logistical support. Right. So people were really in a difficult place.
Yeah.
In the middle of a medical education, which itself is already difficult.
Right.
All of this, here again, I wasn't present at the administrative meetings where these decisions were being made. But from the perspective of a student, all of this seemed to be driven by student retention, tuition retention, type issues, right?
Yeah.
And that is what I think that was probably the first event to leave a sour taste in terms of what are we doing here and why are we doing it?
Yeah. Well, and we're about out of time, but so it's an interesting start of your journey where you got jaded before you were even a doctor.
Yes.
But you did become a doctor.
I did, yeah.
And so, I mean, I think that that's probably where we'll pick up next time.
Fair enough.